On a good day, I am here for 5 to 6 hours, including everything like the transportation home, here, needles, all that. It gets in the way a lot of things. It's pretty much a hassle. That's how I would describe it. The week before is so horrible when it comes to sleep. Like, I'm just so excited. I'm thinking about everything I'm gonna do. Everything. Every little detail. The people I'm gonna meet. What I'm gonna do, you know? And when I finally get there, the excitement just explodes out.
Kids Camp started 25 years ago. It has been at Camp Kopenickanic in Fenton, Michigan that entire time. Over that period of time, over 700 kids have attended camp.
I would say the goal of having children that have end-stage renal disease or even just any type of kidney issues, going to camp would be to provide some normalcy in their lives.
The theme of the Kids Camp is to be a kid for a week. They get to do all of the activities that everybody else does. Transportation, medical treatments, medication are all provided for them, and they can just experience the camp for what it is as a kid. As a kidney patient, they have to be very restrictive with their diet. They have to follow a very strict regimen with the medication that they take, doctor's appointments, dialysis treatments. So there's an awful lot that's required of them at a very tender age to take care of themselves and maintain their health as best they can. At Kids Camp, there's volunteer medical staff that provide treatments in a cabin that's provided for by the camp itself. They get their medication at that particular cabin, and the Kidney Foundation of Michigan also provides the opportunity for the hemodialysis campers to go twice a week and be transported to a nearby dialysis unit where they get their treatments.
At the kidney camp, some doctors and some nurses, they're all from our dialysis unit. They came with us to accompany us to take care of our dialysis needs.
There's a lot of special moments, and we try to make sure that dialysis is necessary and delivered, but basically it's woven into their schedule such that it's not an obstruction. It really allows them to be campers the whole week.
They miss out enough on life with their medical issues and being in hospital. While they're at camp, we don't want them to miss one activity. Energy levels when you're on dialysis can be quite low from being anemic. We want them to realize that a healthy lifestyle is one that includes your medical regime, but also healthy activities, exercise, and that you can be active and it can be in a fun way.
It's pretty close to the funnest thing I've ever done. Like, it has something there for everyone. If you don't like archery, hey, they have sailing. You don't like sailing or archery, they have horses. You don't like any of that, they have the aquabot. You don't like that, they have rock climbing. There's just a long list. You can never be bored of all that stuff. They encourage you to be more active. They encourage you to eat healthier. They encourage you to be more social. When you go to camp, you meet people. You know, you get their Facebook or their phone number. You talk to them for a change. And you come home with 200 people that you didn't know the week before, but now you do. You have 200 phone numbers, emails. When I came home, I had a whole booklet of people.
They go to camp. They meet a kid who has faced many situations much like themselves, and they come back very motivated and inspired to work harder in their day-to-day health maintenance, whether it be physical fitness, adherence to medication, adherence to diet. And many times what they really need is just a little bit of inspiration, and camp gives that to them. It's a wonderful thing. Well, National Kidney Foundation of Michigan has been very, very committed to the children. They've been willing to sponsor camp registration fees for years. As resources sometimes begin to dry up, I hope this is something that the Kidney Foundation can continue to be committed to, and it certainly would be something that we would all want to continue to support.
People who donate to the Kidney Foundation of Michigan Kids Camp can feel good about their donation because it's supporting an experience for kids who have very challenging medical situations in their lives. These kids didn't sign up to be kidney patients. They didn't do anything to deserve this lifestyle that they have to follow. I feel it's our responsibility to provide this opportunity for them to be a kid for just a week.
We get it. We get the big picture in that their life is challenging, but we want to provide, as a hospital and as a medical community, ways to have fun and to be a kid.
There was really no summer camp that I could go to. If I hadn't gone to camp, I would not be as healthy. I wouldn't have met half of the people that I know. Everything you do at camp is something you take home. It's teaching you to be physically, mentally healthy. You know, that's the big picture.